So thank you, everyone. This is our joint news conference for Thursday, November 19th. Thank you, everybody, for participating. So the participants that we have today on our panel, we have Dr. Stephen Mente, County Health Officer, Tony Rojodas Jr., Chief Executive Officer for Imperial County, Mr. Luis A. Blancarte, Chairman, Imperial County Board of Supervisors, Janet Angulo, Director for the Imperial County Public Health Department, Larry Lewis, CEO, Pioneers Memorial Healthcare District, and Adolph Edward, El Centro Regional Medical Center, CEO. So we're going to follow what we've done for the last couple of weeks. We're going to start with an update with Dr. Monday, followed by Janet Angulo. Then we're going to hear from the two hospitals, Pioneers and El Centro, followed by the county CEO. And then we'll review the questions that were submitted previously by local media. And if time permits, we'll open it up to additional questions from the media. So nomás brevemente para hablar de la orden de esta conferencia de prensa, vamos a abrir con el médico oficial del condado, seguido por la directora del Departamento de Salud Pública, después los dos hospitales y cerrando con el oficial ejecutivo en jefe del condado de Imperial. Luego vamos a responder a las preguntas que fueron emitidas por los medios de comunicación y si hay tiempo, después vamos a poder abrirle a preguntas adicionales de los medios de comunicación. Y con eso vamos a seguir y empezar con el doctor Stephen Monday. Dr. Monday, do you want to go ahead and get started, please?
All right, good afternoon, everybody. So as usual, I'm going to start with some quick statistics. And so worldwide, we're at 55.6 million cases and 1.3 million deaths. In the United States, 11.6 million cases and 250,000 deaths. In California, we have about 1.05 million cases and almost 18,500 deaths. In Imperial County, we have 14,644 cases and 353 deaths. Our most recent data with regard to the tiers are that we are currently at a case rate of 35.1 per 100,000, which has been adjusted to 37.6 based on the testing compared to the state's median. And our percentage of positives is 16.5 overall. And in the equity quartile, based on the Healthy Places Index at 12.4. So let me just stop there. And then when we're ready to go to the questions, I will move into those.
Janet.
Muy buenas tardes, mi nombre es Janet Angulo, directora del Departamento de Salud Pública del Condado de Imperial. Brevemente, una actualización, voy a empezar con los casos de Estados Unidos, más de 11 millones de casos, más de 250,000 fallecimientos aquí en California, un poco más de 1 millón de casos positivos y en cuanto a los fallecimientos, más de 18,500. Aquí en el condado de Imperial, acorde a las cifras de California, tenemos más de 14,600 casos positivos y un poco más de 350 fallecimientos. En cuanto a la tasa de casos por cada 100,000 habitantes, estamos viendo un poco más de 35 casos por 100,000 habitantes. El estado usa un factor para ajustar esa tasa y es acorde el número de pruebas que se hacen. Si hacemos menos o si hacemos más, con ese ajuste nuestro número de casos, nuestra tasa de casos sube al 37.6 por cada 100,000 habitantes. Y en cuanto a la positividad en pruebas, el estado ahorita tiene el 16.5% en positividad. Así es de que ahí paramos con el informe y vamos a seguir con las preguntas.
Hi, can we continue with Mr. Lewis from Pioneers?
All right. Yeah, earlier this week we announced that EMSA was going to be arriving in preparation of the continued COVID-19 surge, and they had resources to help us prepare. A portion of those resources has arrived already. That's beginning to be set up even today. There's portable monitors, oxygen concentrators, infusion pumps, ventilators. All of this in preparation as we begin to expand our bed count by 10 using the auditorium here as an alternate patient care site. And this is going to enable us to equip and staff 10 additional intensive care beds upstairs where there are more resources already available. And again, EMSA is going to be supplying those additional beds as well as the staffing to go with that. There have been other resources provided, ER nurses, ICU nurses, intensivists, hospitalists, and there's more expected to arrive in the coming week or two. I think that's pretty much it. That's it. Thank you.
Thank you, Mr. Lewis. Dr. Adolph Edward.
Thank you so much. I want to just get everybody up to speed. I know we published that we have about 120 patients total in-house, 50 of which are actually COVID positive, and that's an increase. I want to support what Larry is saying. EMSA did arrive early. I'm sure everybody has seen our 50-bed expansion tent is already up. We're now talking about the staffing. Our request for staffing includes a total of 27 med-surg nurses, 33 ICU nurses, 3 lab scientists, and 21 emergency room nurses. And I add on to our existing staff of respiratory therapists, we need 6 additional to be able to accommodate the increase. Happy to report that ECRMC had the first patient to be sent to the ACS. Very thankful that we have the capability here in existence and we are actually using it. I'll stop here and I'll take questions.
Thank you. If we can continue with the county CEO, Chief Rojodas.
Hey, obviously we're here to discuss the current activities of COVID occurring within Imperial County. The county's definitely here to support all the avenues of need here in Imperial County through our partnering agencies, El Centro Regional, IVC, and PMH. As we take on this next surge or this next wave of COVID, which we've all been talking about or all of should have expected. I think we've all been anticipating it. We want to make sure we're prepared as much as possible, have the supplies ready. As Dr. Edward just mentioned, you know, there's already activity occurring at El Centro Regional. Larry and his staff are increasing their capabilities, and that's what this is all about, making sure we're prepped and ready and handle the surge as best as possible. We had a strong front. We were hit hard and late the last time around. This time we're being hit with the rest of California, and I think that's going to be discussed a little bit. And I think there's some discussions happening statewide as we sit on this call as well. And it's all about preparation and how we're ready. We need to be very careful with our resources because we're going to be challenged with those resources being asked for our neighboring counties as well that are in purple and experiencing some of the same issues that we experienced the last time and this current time. So I just want to make sure as a county that we can do what we can do on our part to be not just prepared, ready, but help support our agencies, because that's what this is all about. I said we've relied on mutual aid for many years, decades here in California, and we know it well. So let's implement it and lessen the impact as much as possible to our county and the citizens we serve.
Thank you, Chief Rojodas. So we're going to continue on with the questions now, and Dr. Mende is going to be responding to the questions related to that he can respond to from Richard Brown from the Calexico Chronicle, Alexandra Rangel from KYMA, Jennifer from iNews Source San Diego, and Gerardo of El Sol de Tijuana. Go ahead,
Okay,
Dr.
thanks a lot, Medea. All right, everyone. So the first questions from Richard have to do with the rules with regard to facial coverings, social distancing, and gatherings, and what is new and what's been in place. So there's really been a stay-at-home order for many months now, and that has only varied as the tier system took place, and with the different tiers, then there were different requirements, but that's really been in place all along. And of course, we've had our local public health orders as well. They have all along discussed social distancing, and we have described that as being at least 6 feet away from people whenever possible, and if not possible, to use face coverings. And that really hasn't changed, other than at times more specific guidance has come out. So for example, as most of you are probably aware, the state health officer updated the masking guidance recently, and it really just was more about emphasis of what to do in indoor settings, and emphasize the fact that whenever you're indoors, if you're not able to wear a mask, say, for example, because you're eating or whatever, that it's really important that you stay 6 feet apart. So the emphasis is on masking in indoor environments and staying at least 6 feet apart. In outdoor environments, if you are able to be more than 6 feet apart from people, then the masking is less of an issue. But in indoor environments in particular, it's really about wearing a mask whenever you are in an environment where you're not by yourself, especially when you're going to be within 6 feet of other people. Next question that I will address has to do with what messaging will be moving out going forward, whether it has any quantifiable effect, and is it reaching people. So the messaging has gone out in multiple formats throughout the pandemic. We obviously are having press conferences like this, but in addition to that, we have Facebook, we have Twitter, we have email blasts that go out. We communicate directly with the providers and also the residents of our county. There are billboards, there's human interaction. So there's a lot of different ways that these messages are shared. And we do try to use formats that are targeted toward the specific populations that we're trying to reach. So of course, things are in both English and Spanish, but also we try to format them in a way that does reach certain populations of people that are affected by the message. Does it have a quantifiable effect? We do think that it does. We do feel that there are people that do look for these messages and try to absorb the information and, when appropriate, to follow the recommendations. And we do feel that we are reaching people because, again, we are doing it in so many different formats and over again that we really do try to target populations within the county, including those that are hard to reach. So, for example, if we have populations that maybe don't have a computer, then we have other ways to try to reach out to them. It's really about the sort of general messaging that goes out and then targeting specific populations that particularly might be impacted or that we feel might have a challenge at receiving the information. Next question has to do with talking about mortality rates compared to cases and hospitalizations. It notes that we seem to have slowed in comparison with regard to deaths, comparing case rates and hospitalizations. Is that true, and if so, why? And then along those lines, there's discussion in the next question with regard to whether there's a pause. And the answer is yes, there's a pause. All of these measurements that we take give us useful information, but they all give us slightly different information. And so when we start to see the case percentages, the testing percentages increase, then we expect that soon thereafter that the case rates will start to increase. Obviously, that's assuming that they continue to go up. There's blips from day to day, but if the trend and the percentage positive is increasing over time, we expect the case rates are going to be increasing as well. Along those lines, we would ultimately expect the death rates to increase as well, but there's always a delay, and that's because it takes a while to gather that information, but also for the illness to run its course. So, keep in mind that somebody gets exposed, it can be up to 14 days later from the time of the exposure before they become ill. Obviously, then they can start potentially spreading that to other people. Those, of course, increase the case rates. Then once somebody contracts it, the severity of the illness can worsen after that first week. So we may identify the case, but then in the second or the third week, perhaps they get worse and ultimately they might succumb. So yes, there is a delay, and that's why it's really important that we measure all of these things, because they do give us different information and help us determine the time course and what the trajectory of the disease is. Is it increasing? Is it decreasing? Is it staying steady? All of those things are useful information to help us make decisions about what resources we need to do and what we would like to target. I think, let me just see if there's any more in this group of questions that I should answer. The only one that I would answer was actually directed toward Jeanette, but it's actually one that I should answer, and that has to do with Calexico, and it has to do with the fact that they're saying that about 1 out of every 10 or so inhabitants has been infected, many of them having been asymptomatic, and it's a question with regard to whether or not this would help with herd immunity. And what I would say is that even if 1 in 10 or even 1 in 5 inhabitants had been infected and at least temporarily had immunity, that's not really herd immunity, because for a disease like this, we would expect that we would at least want to have 70% of people or more immune, and that could be obviously via vaccination. It doesn't necessarily mean that they have to have contracted the illness, but having 10% or even 20% of your population immune unfortunately doesn't constitute immunity, because it's not enough people to prevent transmission. The whole point of herd immunity is that you have enough of the population that is already immune, that if they get exposed, they don't then spread that disease to other people who are not already immune. In the case of something like measles, the number needed to prevent measles transmission is probably at least 95%, because it's so contagious. In respiratory illnesses, for example, influenza or in COVID, that number is probably closer to 70. Obviously, as we learn more about COVID in particular, we'll learn more about what that specific number is. But definitely it's way more than 1 in 10 or close to that number. So I think that's all the questions that I was specifically planning to answer, although I'm certainly happy to weigh on any others. So Medea, I'll turn it back to you for further answers to the other questions.
Thank you, Dr. Monday. So the next one is for Mr. Lewis. The question says, Mr. Lewis briefly made mention in a press release on Tuesday that patients from the border transported by ambulance were being alternately brought to El Centro Regional and Pioneers Memorial Hospital. Is that for COVID or all illnesses, and how is that working so far? And has there been an uptick in border calls due to COVID recently?
Yeah, and the EMS advisor that came out on Tuesday had advised that that was just implemented like 48 hours ago. And we have not seen a great deal of a difference in border transports. Don't know if we will. We were talking though about how do we help balance the workload in the county, as El Centro is definitely bulging at the seams there, and we still have some capacity. So even as Dr. Edward and I had spoken, we both have an interest in making sure that where it's possible and where resources are available in the county, we should try to keep patients close to their families and friends as much as possible. And so we're agreeing to contact each other to make sure that before we send somebody out of the county, that we will check with each other on our own availability. I believe that the release from EMS also indicated, yes, it is only about the COVID or patients under investigation for COVID that are affected by that. So Dr. Edward, I don't know if you have anything more to comment on that.
Yes, I just want to remind everybody too that not every patient that comes to our emergency room is coming through an ambulance run. We do have actually patients that get into their car and drive to the EDs. So the balancing that is created through that effort is a great one that can help us in the county. And at the same time, we are open to accept whoever comes to us. And I'm sure Larry gets those same folks that just drive directly to the ED.
Absolutely.
Thank you. So the next question is for Tony or Supervisor Plancarte. The question is there any concern over the extension of the ban or non-essential border travel? Right thing to do or bad for the economy?
So I don't think Supervisor Plancarte is on, so I'll take that one. You know, of course, it's a balancing act. We've had this discussion since the beginning. We live in a community that is obviously we're right next to a border, so we've been used to that for forever. And we also have to remember that's where a great deal of our workforce goes and a great deal of our economy shifts back and forth from Mexico into the U.S. and vice versa. So the restrictions, some people see it as a good thing. However, in some industry, it's obviously an impact. But it's also something we have to take care of. You know, I do think, I don't know if Jeanette or maybe Jeff Lamore are going to talk to about a little bit where we were talking earlier is some of the testing we're going to potentially start doing out in the field and being proactive with that, some of the workforce that we do get impacted from across the other side of the border. But to do mobile testing out in farmland, farm areas with the farm industry, cattle industry, and some of the other industry out in the populace that we can cover and just bring safeguards to our own valley. The economic impact is definitely there. We have people that travel back and forth, live on one side or work on the other side, and they come over here and spend money and vice versa. So it does have its positives, but it has its negative because we also have over 1 million people living across the border, and that population, you know, has been impacted by COVID as much, if not more, than this side of the border as well. So it's just an area of concern that we have to be cognizant of. However, if we take the right precautions in place and continue to do what we need to do and not engage in activities that are harmful to us, it should be okay.
Thank you. And another question is, what is the county doing to help businesses who have been hit the hardest by these border closures, especially in Calexico, where 80 to 90% of their customers come from Mexicali?
Yeah, so Imperial County has already issued or made available $1 million in small business administration loans through our public and ag benefit process. The loans were available for $10,000. Basically, you just had to write a small summary on the hardships COVID has brought to you, show a copy of your business license, and a very minor application. To date, we've probably processed $800,000 in those $10,000 applications. So we still have a couple $100,000 available, and we still continue to evaluate those. On Tuesday, Mr. Jeff Lamore presented a plan that my office and Environmental Health came up with the use of CARES Act. I think the press release went out last night. We're also making a $1,500 very easy to apply for grants. $1,500 available to up to 1,000 restaurants. I think our restaurants have been impacted. However, there is some minor things they can do to boost up their business now with purchasing tents, outside tables and chairs to make outside dining available. So we thought that we would make these grants available. They'd not have to pay back. A very, very simple application, a copy of their business license, I think a W-9 driver's license, and a very small summary on how COVID has impacted their business. And it's almost an automatic $1,500. And we sent that out with over 740 correspondents from Jeff's office. However, we will fund up to 1,000 restaurants, but we know we have 740 readily available to go today. I mean, I know it's a small bucket to some of what these people have lost, but it's what the county can do today. And we're also working on a couple of other programs that we'll be unveiling over the next couple of days, and look forward to anything we can do to help our citizens and our businesses. We're really trying to focus on that.
Okay, and the third and last question from KYMA says, Supervisor Escobar had mentioned several weeks ago that there were talks to help decrease border wait times during peak hours. Have there been any updates regarding this?
I know Supervisor Escobar and a contingent of county staff has been meeting with the city of Calexico and federal personnel on a weekly basis and zooming in. I was not part of the last conversation. There has not been a lot of discussion, but the discussions have continued.
Thank you. And the questions from iNewsSource San Diego have to do with patient transfers, but it sounds like that's not something that's currently happening. So am I correct with the two hospitals saying we're not actively transferring patients from Imperial County elsewhere at this point?
Yeah, Maria, I think I chatted with Jennifer earlier about the transfers for things like MIs and what have you. These are normal transfers. So I think that question has been answered.
Okay.
Similarly here at Pioneers, there's been next to zero transfers related to lack of space availability, certainly not for COVID patients. And we don't expect to see that either. And again, with that mutual support between the two hospitals, we'll do our best to minimize that.
Thank you. And this next question is for Jeanette. It says, have you received any requests from Baja California authorities requesting support or establishing coordination to address the pandemic? And in what percentage have you detected people who were infected during a trip to Mexico?
Question, should I answer in Espanol because this is coming from El Sol de Tijuana, or English?
We've answered all of them in English at this point, so it's up to you.
Okay, so we've worked very closely with our Baja California counterparts, and from the county's end, we've worked with our partners from Mexicali and the state of Baja California through the Emergency Operations Center. And there's been quite a bit of work done over the last few months. As far as public health in particular, we joined forces in a binational campaign, and messaging has been going out. I also know that some of our local partners, like the hospitals, have also been working with our counterparts in Mexicali. So I'll stop there. And I don't know if Dr. Edward or Larry want to add anything.
Go ahead, Adol.
We are hosting a team of physicians tomorrow to talk to our intensivist team from UCSD, just so that there is conversations continuing on with the Baja California guys. And then I have a CEO from the hospital is calling me tomorrow to just to chat and see what else we can work together, but there is no identified needs so far.
Thank you. So it seems like that is the end of the questions that were previously submitted. So if there are any other media on the line who want to submit a question, ¿hay otros medios de comunicación que tengan una pregunta que quieran hacer su pregunta en este momento?
Hey, Maria, while we're waiting, I'd like to just make a couple of additional comments because in case anybody missed it, the state health officer actually just put out a new limited stay-at-home order literally just a few minutes ago. It's dated as of today. And essentially what it says is that for counties in the purple tier, that there's going to be a time limit on being outside. Basically, it says that, let me just read it rather than just fumbling through it. It says, therefore, as the state public health officer, I am issuing a limited stay-at-home order effective in counties under Tier 1, which means the purple counties, requiring that all gatherings with members of other households and all activities conducted outside the residence, lodging, or temporary accommodation with members of other households cease between 10 p.m. and 5 a.m. and that's Pacific Standard Time, except for those activities associated with the operation, maintenance, or usage of critical infrastructure or required by law. It also says that it doesn't apply to people that are experiencing homelessness. So just wanted to make sure, in case everybody missed that because they were here, that order literally just came out not very long ago. And obviously, if there's any questions about it, I'm happy to answer them.
Are there any questions from the media that's on the call?
Maria, there was a question that we didn't answer, and it was the second question of El Sol de Tijuana. And then I would like to add just some messages about the upcoming holiday. So the question was about the percentage that we've detected of people who were infected during a trip to Mexico. Unfortunately, that data is not available, but I just didn't want that question to be left to the side. So the data is not available. And then we have a major holiday coming up, and we need to make sure that our community takes the needed prevention steps to protect themselves and others that are in around them. One way is to get the flu shot, and if they haven't received one yet, we do have an upcoming activity, a drive-through flu clinic at the Imperial County Fairgrounds, November 21st from 7 a.m. to 10 a.m. The vaccine is also available with pharmacies and with some medical providers. So encouraging the community to get a flu shot. And then all those, again, prevention measures, the use of face coverings, the social distancing, it's going to be very, very important, that we practice during the holidays.
We do have a question that came in from Richard Brown, and I think he's referring to what Dr. Monday just shared. He said, is this the curfew that Newsom was alluding to Monday on the limited stay-at-home order?
Well, obviously you can have a debate about what the language is and what word to use. Obviously they're not really calling it a curfew, but yes, I think in principle that's what they're discussing. And I mean, if you read the document, I think it makes it clear, and I completely agree with this, that other than people that are doing essential work, for the most part, when people are out between 10 and 5, it's in some sort of a social setting. That's obviously most of us work during the day and tend to do things socially in the evening. And so the point of it is to allow the types of businesses that or business that needs to take place, and then encourage people, after hours to go home as opposed to gathering with other people outside of their household. I think that Dr. Pond describes that well in her order.
Thank you, Dr. Monday. So I don't see any other questions submitted in the chat box. So it seems like that is it for the questions from the participating media. So I want to thank everybody for calling in this afternoon and participating and submitting your questions ahead of time. I do want to share that next week we don't have a scheduled news conference because of the Thanksgiving Day holiday. With the understanding that if there is breaking information that we need to share, we will do one early in the week. So again, we will continue pushing information out and sharing with the media as we receive it. Thank you everyone for connecting with us this afternoon, and we will stay in touch. Thank you. Goodbye.
Thank you. Bye.
Bye.
Thank you. Bye.